Hi, I'm Steph. I'm the dermatologist at Langford, and in this series we're going to be talking about otitis in the dog. And in the first video we're going to be looking at a bit of an introduction to otitis, and we're going to be looking a little bit at the primary factors, predisposing, perpetuating and secondary problems that we might see and how we can break those down in practice. So otitis is really common in clinical practice. You're going to see it very commonly, and it's very frustrating for patients, vets, owners. It can be very painful, and we very commonly see these repeat cycles of inflammation and infection. With each cycle we get progressively acquired pathological changes. So for example, we start to see hyperplasia of the ceruminous glands, we see stenosis of the canal, and we see impairment of the ear's normal self-cleaning mechanism. These are our perpetuating changes, and we'll talk more about these in a moment. These changes make the infections harder to resolve, and they drive further changes. And then with time and progressive chronic changes, these episodes of otitis get more frequent, more severe and more difficult to manage. So why is otitis a problem? It can be really painful, and many owners come in and say, oh, my dog seems fine, they don't seem painful, and often that is the case, particularly when we think about our lively Labradors and Spaniels. They often seem absolutely fine, but what we then find is when we give them some pain relief and we treat their ears, the owners report that they're much brighter and much more their normal selves, so there obviously was a significant pain component that the dog was masking. What we know from a behavioural point of view as well is that pain can cause irritability, it can cause anxiety, and so we then get changes to their rest and sleep cycles, and this can lead to increased frustration. What we then start to see is confrontational behaviours becoming more common, so they can become very head shy with handling, and that's not just at the vets, that can be with owners trying to put collars on, trying to interact with them at home. That can be groomers. We see a lot of cockapoos and poodle crosses now that need a lot of grooming, and it's very common for these dogs to start having problems at the groomers. This is because they learn that handling of the head is painful. It's hardwired into us that we need to protect our head, and so if you've had painful ears that people keep repeatedly touching, you soon become quite resistant to that. You can even then get problems with things like noise reactivity and eating, and so actually this can become a much bigger problem than it originally was if we don't get on top of it. And so the PSPP, this is really important, and no doubt many of you will have heard it before, perhaps at lectures at university, conferences, journals. It's something that gets repeated, but it's really important kind of fundamental principle to come back to. So what we have to remember is that otitis externa is multifactorial. We're not just getting ear infections, we're getting lots of problems that always has an underlying primary cause, and it's really important to address all of those. So if we just break the PSPP down, so predisposing factors initially, these are factors that on their own are not going to directly cause disease, but they do contribute to disease developing. Our primary factors are things that directly cause ear disease. Our perpetuating factors are things that we've already mentioned. They happen because of the otitis, and then they make it harder to treat and harder to keep on top of. They drive the disease process. And then we have secondary factors, and this is our secondary infection. So it's important to remember that the infection is never primary, it's always a secondary infection, and this is something we must talk about. Okay, so let's think about our primary causes. In the vast majority of these dogs, something like 70 to 80% in the literature, these dogs have got allergic skin disease, and that can be atopic dermatitis, so environmental allergies, or that can be food allergies. It can sometimes be a combination of the two. We do also see a small percentage of dogs that have like an allergic or contact irritant dermatitis due to things being put in their ears. We sometimes have owners using cleaners or powders at home. I've had owners before using dilute Dettol or apple cider vinegar. These things to us as vets may seem like a strange thing to put into an ear, but owners in desperation often try all sorts of things. But for the majority of these dogs, this is an allergic skin disease that we're seeing. We mustn't forget our other differentials though. So an acute onset unilateral ear disease, often in a spaniel in the summer, a grass seed has to be up there, and many allergic dogs can develop an acute otitis, so we mustn't immediately say, well, it must be a grass seed, but we also mustn't forget the grass seeds. Those ears can be very painful. We sometimes do need to sedate or anaesthetise the dog to properly look for the grass seed. It may be broken up and embedded right down by the eardrum. We need to be careful not to cause more damage. Parasites are another thing. Now, these are not as common in older animals, but certainly Otidectes we see in our puppies and kittens. These are quite easy to see on cytology. These are less likely to be a problem in older animals. I've mentioned Demodex on there. We don't see as many cases of Demodex these days because of isoxazolines, but our generalised demodicosis cases can involve otitis. And then there's a variety of other ones on there that are all less common and are all going to have other clinical signs. So things like our pemphigus, for example, is an immune-mediated condition. Those dogs won't just come in with otitis, but they're all things that are important to think about as well. Secondary causes, we've also already said this is our infection. In acute disease, we tend to get our gram-positive bacteria, things like our Stephs and our Streps, that we might see in an ear anyway, and they're just overgrowing. And then we get our Malassez, our yeast. In more chronic disease, we really see a trend towards gram-negative bacteria, and that's where things like Pseudomonas very commonly, but also Proteus and E. coli can come in. And as I've already said and will keep saying, it's really important to remember that this is secondary. So we often get very hung up on we can't get rid of the infection keeps coming back, but we have to remember it's only part of the puzzle. Our predisposing factors then, these I think are possibly misunderstood by a lot of vets in practice and a lot of owners as well. So we think about our hairy ears. How many cockapoos do we see with very hairy ears? Our Labradoodles, our Golden Doodles. They can have really hairy ears, but on its own, that's not a primary cause. The hair doesn't cause the ear disease. The hair is just something that's going to predispose to problems. So if we have a cockapoo with hairy ears who's also got allergic skin disease, then we're going to get otitis. But the hairy ears on its own shouldn't be a problem. We talk about our pendulous pinna. This is things like our Spaniels, our Labradors, our Bassets. So now some dogs do seem to have an increased density of ceruminous glands, and we do see this sometimes in our Spaniels. They can be prone to more changes there. That again is a predisposing thing. Swimming and overcleaning I would lump in together. Now swimming is something owners know about. Many owners will come in and report that they've been swimming and that's why they've got the ear problem. And in a small number of cases perhaps that is true. If the dog has genuinely submerged their head in a really horrible pond or body of water, perhaps they have genuinely got some infection in there. But I would say that's not the norm. Normally all swimming is doing is making the ears very wet, and this is then predisposing to a problem. Similarly with cleaning I think people think, well, the dog's getting ear infections or dirty ears, as owners will often say, we must clean the ears more, but actually all this is doing is making the ears very wet, similar to swimming, irritating the ears, interfering with the ear's normal self-cleaning mechanism, and in some cases actually just really impacting the material deeper into the ear canal. So this is another predisposing problem we must remember and try to avoid. And then hair plucking is a really difficult one, again with our poodle crosses. Many groomers and owners will pluck ears. It does divide opinion, but generally the advice is not to routinely pluck ears, just because all we're doing is causing little microtraumas that predispose to further problems. And then finally our perpetuating factors. It's really important to address these, and they can be very severe and they will get worse with time and with severity. So if early changes are not recognised, it becomes much harder to resolve and treat these changes. So initially we may see a cobblestone appearance, and this is just hyperplasia of the glands in the ear, often the ceruminous glands. We also start to see interruption to our epithelial cell migration, and that just means that the discharge is not being taken out of the ears as it normally would. With time we start getting complete failure of the epithelial cell migration. We start getting stenosis, we get marked hyperplasia of the epithelial lining. We can get fibrosis and even mineralisation in some cases, and some of our end-stage ears are almost completely occluded. And the key is to get on top of these cases before we get there, so we can avoid having to send them to surgery. And so our approach to otitis, each case we can approach in a very similar way, and we'll talk more about that in the next video. So we're going to go through a thorough history, and that's a general history as well as a dermatological. We're going to examine the animal, again the whole animal, not just the ears, and then the rest of the skin as well. Cytology is essential, otoscopy if appropriate or possible, and then we may need to do further procedures or diagnostics, and again we're going to talk about that in the next video. So coming up in the next video, we're going to be taking a more thorough look at our history taking and our diagnostic techniques when it comes to otitis. So please tune in and watch the next video.